Good afternoon and welcome to Efficient Innovation Keys to Health System Leaders Engaging with Startups, a health system CIO production sponsored by Techstars. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the founder and editor-in-chief of Health System CIO, and I'll be your moderator today. We're looking forward to your participation. You can send in your questions or comments anytime in the Q&A box, and we'll take them later in the program. Just so you see how we're going to spend our time today, first we're going to go about 40 minutes with our main panel discussion featuring Warren D'Souza, SVP, Chief Innovation Officer with the University of Maryland Medical System. Deanna Hanisch, who's now CIO at Johns Hopkins Medicine, recently promoted. Congratulations, Deanna. Kelly Coe, PhD and VP for Innovation and Strategic Initiatives with Sharp Healthcare, and Nick Culbertson, Managing Director with Techstars. And then we will have our Q&A. So let's jump right in. Warren, let's start with you. Can you give us an overview of your organization and your role?
Sure. Good afternoon, everyone. Anthony, thank you again for having me on this panel. Real delight to share the stage with my colleagues here. So I serve as the Chief Innovation Officer for the University of Maryland Medical System. We are a roughly $5.1 billion health system headquartered in Baltimore, Maryland, with 11 hospitals across the state of Maryland and about 150 odd clinical practice site locations. We are foundational partners with the University of Maryland, Baltimore, where all the professional schools are of the University System of Maryland, and so inherently embrace the notion of being an academic health system. I also serve as the co-director for the Institute for Health Computing within the university and the health system collaborative, and run our innovation and incubation studio called iHarbor, which is a subsidiary of the health system.
Thank you, Warren. Deanna?
Hey, Anthony, and thanks so much for having me. I am the Deanna Hanisch. As you mentioned, I am the CIO of Johns Hopkins Health System, which is a part of Johns Hopkins Medicine. So Johns Hopkins Health System has 6 hospitals and a large footprint that both sits in community practice as well as academic. I oversee all of our clinical applications and the support across all of the hospital and clinics.
Very good, Deanna. Thank you. Kelly?
Good morning, and thank you, Anthony. My name is Kelly Coe. I have the pleasure of serving as Sharp's Vice President of Innovation and Strategic Initiatives. Sharp Healthcare is an integrated delivery network based out of San Diego, California, 4 acute care hospitals, 3 specialty hospitals, 3 medical groups, health plan, multiple urgent care, and clinics throughout the county. And I have the pleasure of leading Sharp Ventures, which is Sharp Healthcare's innovation and strategic commercialization arm. So we focus in on diversification of revenue, strategic partnerships with both startups as well as established large technology companies to bring new products and services to the marketplace.
Thank you, Kelly. Nick?
Hey everyone, I'm Nick Culbertson, and I'm formerly the CEO and co-founder of Panelists, an AI health company that had the pleasure of working with these 3 great individuals in health systems over the past 10 years. I recently exited that company earlier this year and attribute a lot of my success not only to the partnership that we have with our customers, but also the terrific advice that I received from tremendous mentors along the way. And so now I'm passing forward that advice and mentorship in my new role as managing director with Techstars, where I lead the accelerator focus on AI and health. And so a big part of my role is bringing in innovative companies and helping them achieve additional commercial traction as they find their product market fit and getting ready for investor readiness to fundraise and achieve their success as a venture backable business.
Very good, Nick. Thank you. All right, let's jump right in. Lots to talk about here. Many issues. Warren, we're going to start with you. How do you define efficient innovation? That's what we used in the title of this event. So how do you define that, and what makes an innovation partnership worth pursuing?
Sure. I think, Anthony, it starts first and foremost with identifying a compelling problem. understanding pain points from a customer lens or health system lens, I think is critical. That followed by ensuring that the solution itself is compelling. Um, it also helps if these particular activities tend to be aligned with the strategic priorities of the health systems. I always think about starting with opportunity statements and problem statements, and then working your way towards the solution, as opposed to the other way around of creating solutions that are in search of problems. So understanding those strategic priorities of health systems and then aligning them with the novel and disruptive technologies, I think is key to ensure that you have the right value prop to ensure efficiency, particularly in the innovation space.
Thank you, Warren. Very good. Deanna?
I thought Warren said it well. It's finding a really compelling problem and a really compelling solution. For me, it all comes down to delivery. I think it's all on the execution to deliver any kind of efficient innovation, because it only matters if we're able to turn it on than if we're able to scale it. So we're often looking for things that are both important but also practical. Things that we can do that are maximizing the value of both of the innovations company's time as well as our time, and getting things stood up and tried and then really scaled. So it's an important thing to kind of find that balance, especially when we're new in space or in pursuing a new space. We're looking for things that are going to improve kind of our patient care, but really as importantly, it's our operations as well. So it's focusing in on the day-to-day. It's really hard to be a healthcare provider these days. It's hard. There's a lot of administrative overhead. There's a lot of burden all around. And there's a lot of ways technology can help that. And that can come in really simple, small solutions. It can come in big, complex ones. But finding ways to start working with a group and solving a problem and then growing that has been really important for us.
Yeah, quick follow-up, Deanna. You talk about the day-to-day operations, and when you talk about that, what I think of is the deep knowledge of those operations that's necessary for a company to develop a solution that addresses them. A lot of, companies say they have trouble getting in to the healthcare environment. Um, so it's like a chicken or egg thing, right? It's like we want to solve problems for healthcare, but healthcare says, well, you can't solve our problems because you don't know what they are, but you won't let us in. So any thoughts there?
Yes, I think some of our best innovations, and maybe I'll give credit to Nick here as a young med student, I remember coming in thinking through what problems can we solve. A lot of being a really good innovator is being a phenomenal listener and finding ways into really understanding and not finding the most obvious problem, but the one that we really need solved. And so I think an avenue in is working through connections, working through programs like Techstars, thinking through what connections you already have by having real experience or people who are really living in those operational problems. I think there's a lot of things that we do in the healthcare space that are still really manual in nature. And learning those behind the scenes and administrative problems are often where we can get earlier value. And then you can start to, once that relationship is established, it's easier to learn in new spaces. And so I think it's really starting in places where you can get any kind of foothold and any kind of understanding.
Yeah, very good. Kelly?
Sure. I love this question because one of the first things that we did when we started Sharp Ventures was around how do we even look at innovation, right? Because innovation means a million different things to a lot of folks, and it's thrown around. And even in my own org, it had 3 or 4 different committees focused on innovation. And so one of the first things that I look for here is where can we really provide value and introduce a new product or service? So not something that someone else is doing, but where are we uniquely positioned to develop and or design, whether it's workflow, technology, data platforms, et cetera. And so the first thing for me is very much, where is this going to address a much needed gap? And is it enough of a distinction that we can bring to the table that really helps determine, okay, is this an innovation worth pursuing? And when we think about partnerships, one of the things that we look for in that is, do you have working knowledge of what are the surrogate kind of solutions that are out there. How do you distinctively provide some unique market value? And then how do we at Sharp, and really any health system, how are we best positioned to bring that to light? Because ultimately time is not your friend in this space. There's too much new technology and companies happening. So you got to ask yourself, what's the runway that we have here? Is this something that's going to be net new and address, per Warren and Deanna's comments earlier, a much needed area of need in our org? And then how can we move on that? Because it's too crowded of a marketplace with all the different technology vendors out there, especially the big box vendors, to address something that's got too many adjacent solutions. So we always ask ourselves, like, how is this uniquely different? And how much runway do we have before we feel like we can stay competitive in identifying the distinctiveness of that?
Excellent. Nick, what are your thoughts on what you're hearing?
I'd like to reinforce what Deanna said about important but practical, because so much innovation in healthcare is a terrific idea, saving lives, improving physician satisfaction, increasing workflow efficiency, all these really positive benefits. But at the end of the day, hospitals are businesses. And I like to look to see how tech is showing up on the profit and loss of the customer. Is it helping them save money, or is it helping them make money? And if you're going to say we're going to save time, then that's great. Are you going to be able to use that save time to generate more revenue, or are you going to use that to cut cost in some way? Or how is it actually going to be practical? Because hospitals can't just keep buying SaaS, can't keep buying software and not have anything to show for it. And I think a lot of startups get into the trouble of thinking that, like, well, this is just a really good cause, but not understanding the practicality of their tech and how it gets implicated into the very complicated administrative complexity of underbelly of healthcare. And if you don't solve that, then you don't get to be innovative. You don't get to actually see your product come to market.
So, Nick, would the interesting thing about the ambient AI, which is taken off like wildfire because it's a tool that works exceptionally well for solving a real problem, yet there's a bit of a soft ROI as opposed to a hard ROI, decreases pajama time. Everything I see, physicians are happier. So it's got that ROI. So is that like a one-off where you would not encourage young startup leaders to say soft ROI is fine, guys. Don't worry about it, right?
Well, I'll say this as a non-employee of a healthcare system, but I think sometimes we have to create innovation to fix tech too. And I think it's not a surprise that a lot of our medical record and a lot of our workflows are very tedious and require physicians to spend time away from patients and on documentation. And so helping physicians turn back towards primary care delivery, there is a measurable benefit to that. And I think you can show by better patient satisfaction leads to better patient engagement, which leads to better patient revenue. And so there might be a couple steps how you
Yeah,
show up on the P&L, but I still think you can draw those steps.
that's really interesting, that concept of steps are okay if they're real, if they're not phony, if they're not too ridiculous, right?
And how do you prove them? How do you build an experiment to actually demonstrate that ROI over time? And how do you find partners that are willing to give you the chance to
Yep.
demonstrate that in a controlled environment?
Excellent. Very good. All right, Deanna, we're going to start with you. When evaluating startups, what role does your system strategic roadmap play? We talked about this a little bit. And it's this idea of, and everyone will say, you find your problems, you find your pain points, and then you go out and solve for your pain points. Which makes a lot of sense, but I feel like it's a little too black and white. Like there is a need to expose yourself to everything going on as much as possible. Sometimes you can solve a problem that you didn't even know you had. So I don't know. What are your thoughts there, Deanna, around, I guess you're staying focused by solving the problems, but does that mean that, you're not going to take a meeting or you're not going to listen or you're not going to investigate something if you don't have a need for it at the moment?
It's a wonderful question. And I think the ideal state is you identify your problems and you go find solutions. That maybe covers about 10% of how we actually bring really innovative tech in. I think going back to an AI scribe, it wasn't on anyone's roadmap that we must have an AI scribe in here. And yet it is one of the projects that's added the most joy and has been one of the biggest game changers for us. So I think there is a little bit of how much are we being proactive versus how much are we reacting to the market and really realizing the opportunity that's out there. I think so we like to look, when we have big strategic initiatives, I think we have a little bit more patience. We're looking a little bit bigger picture and a little bit longer term on who we're partnering with. When you're looking at where the technology is ready or where there's just a great idea from a startup, we'll be opportunistic. Just because we didn't think of it or because it wasn't on our roadmap doesn't make it not a wonderful use of time. It just means that it needs to be a really compelling and succinct pitch and realistic. And I think that is often where we get some of our favorite innovations. That's where we move often the fastest because it's the technology and the companies are ready. So it's both. And I think many groups out there will say it's yes and in these areas. It's a little bit hard to get through the volume of companies out there pitching, which is a challenge we are all faced with. And where do you hear the real? But I think the strategy for us sets us looking, but what we actually tend to find tends to be where companies are just really doing something cool that we think is worthwhile.
Excellent. Very good. Kelly?
I 100% agree with you, Deanna. And I think the other thing is you can't afford not to entertain all of those other ideas, because the reality of it is that we've got a lot of, I'm not going to say problems, I'm going to say challenges in healthcare, many of which that don't show up on our strategic priorities or roadmaps, because otherwise that list would be a mile long. And so oftentimes you don't necessarily know all of the pressing problems at the health system until you start to unpack it a bit. And so to that degree, I think you have to be open to looking at other areas or other startups that maybe aren't on your strategic roadmap, but are worth a listen, right? Because eventually it may not be a matter of if, it's a matter of when. At some point, these things are going to come up and you're going to want to be familiar with how that goes. And because the volume of companies and the volume of potential challenges is out there, one thing I would impress upon this group, and I know what's been successful for Sharp here, is that we don't try to do it all ourselves. We partner with local accelerators, local incubators. We are in strategic partnership with our local Techstars partners with an Evo Nexus, our local incubator. So we outsource and they help us farm out, gosh, what are you guys seeing out there, right? Because my team and I, we can't focus on all of those areas, and we might miss something as well, right? And so I think being able to be open to that, hackathons are another good example, right? Put it out there and just to see. Now, it is to our benefit to then be able to regulate what we see and filter that, but it's better if you have the ability to manage that kind of inbox to be able to say, hey, what are the things that are out there? Are there problems out there that perhaps I'm not aware of, both from a frontline clinician perspective and a market perspective, and how do I keep those on my radar? If not for today, then maybe for tomorrow.
Yeah, very good. Warren, this is an interesting topic, right? I mean, I would imagine one of the greatest values a healthcare IT leader can provide their organization is you're supposed to know as much as possible about what's possible, about what the market has and what's out there, so that when you're in a meeting and you hear operations folks express a problem they're describing, you can mentally connect that. And so, you know what? I did hear about this thing, right? But if you're only focused on solving the problems you know about, you may not be in that position because you haven't cast as wide a net. What are your thoughts?
Yeah, no, I agree with both Kelly and what Deanna have said. I think this is sort of your classic example of health systems by nature are bureaucracies. They're very large bureaucracies and tend to, there is an enormous amount of inertia that sort of pulls individuals, including the innovation ecosystems, into their burning platforms and priorities. And so a lot of effort naturally gets devoted to identifying some of the more classical problems. And the risk there for health systems is what's not in their field of view. The true disruptors, the true transformational technologies or companies that may be surfacing. And so this is a prime example of you don't know what you don't know. And so one of the things that we try very much to stay abreast of is understanding what currently exists or operates at the periphery, something that is not sort of the fad of the day, but could very easily become the next AI scribe type ecosystem. As Deanna rightly points out, this is not something that was on anyone's radar perhaps 10, 12 years ago. But clearly, and I loved what Nick said about technology to fix technology, to put a spin on it. But I think these kinds of things are critical for health systems to open up that field of view to create that broader lens. Having said that, I'll also just mention that health systems are also risk averse. And so it is risk mitigation or some appreciation of risk is really critical in managing those conversations with entities that are high risk, high reward. I think it's also critical to ensure that within the context of that risk assessment or conversation, there's also an appreciation of what the ROI or potential ROI is. I mean, clearly, if technologies are truly innovative, they haven't had the runway, they aren't widely disseminated or deployed, and so to get a foot in the door, I think managing both risk and an appreciation of what that value proposition, I think Nick alluded to this earlier, certainly would get the attention and should get the attention of health systems.
Very good, Nick.
I just want to build on what Lauren was saying about being a bureaucracy and being risk adverse. I think sometimes we characterize hospitals that as if it's by choice, and like hospitals are bad because they're slow and bureaucratic. And I think if you look at the underlying reason, the average hospital in the US has only a few points of operating margin. And if you're trying to care for the lives of millions of patients a year that go into your ecosystem, you do not want to have wild swings of risk taking and be in a situation where you lose money. And so I think it is super important that hospitals are thoughtful and risk adverse and very focused on the bottom line of their mission. And I think startups need to also recognize that coming in to work with their partners, which goes back to what Deanna said about listening. Because sometimes the reason that innovation doesn't work is not because it's not a good idea. It's because of the environment as all sorts of complexity. And a really great example of this that we see a lot in healthcare is that vendor consolidation. If you have a really great product that's the best product in the market, but another vendor sells that product, even if it's 30% as good as your product, but they have 10 other, 20 other offerings that you can bundle together in one price, it's really hard to have to switch vendors for that one product and have yet another vendor for another solution that's then going to have to talk to everything else that may not be native to that existing established vendors. So it's both a barrier for startups to overcome, but it's also a really important dynamic to understand because that's the ecosystem that we operate in for good reason.
Yeah, Nick, go ahead.
And
Go
so
ahead,
I
Kelly.
will say onto that comment, Nick, also if you're a startup company out there and I think one of the benefits of what Nick just outlined here is because we are all operating, especially in the nonprofit space, on very short operating margins. When we make an investment in time and capital or a bet on your company, we are very much incentivized to make sure you're successful, because I've been on the other side of that where I've had to be in front of investment committee meetings and say, gosh, here's why this investment didn't work out. And it's a crummy situation, right? And of course, there's understanding when you make capital, sweat equity investments in companies, they don't always work out. But one thing that I think is not to be lost on the audience here is if you are a startup company, part of my job is to make sure you are successful, because I am equally as invested in your success. I cannot wipe my hands and walk away from this if you're on a 2% operating margin and it's like, hey, the innovation or the IT folks decided that this startup company was a good investment and a good idea, didn't work out. Like, you don't get a pass on those. And so I think in some regards, if you're a startup company out there, the idea of not just partnership, but very much deep embedded partnership, take advantage of that. You can make I don't want to say demand, but you can make an ask in terms of making sure that you have the supports and the resources that you need, because no one's going to get a pass if you are not successful and you are brought into that health system. Like, that's a very powerful incentive.
Yeah, Kelly, just following up on that, do you think, I mean, I would imagine there have been situations where a pilot failed, but it really wasn't the fault of the company. It was the fault of the health system, maybe not giving them the proper support. I've heard about things like that in the past where, you know, you have to be careful as a startup the deal that you make, right? Because
Oh,
you
yeah.
can wind up having all your resources sort of sucked dry in one pilot, and then they're done with you, and you're done. You're out of runway. So there's risk on both sides.
There absolutely is. And I will say, so that example that you just pointed out, the guidance I always give to startups, because we're in a position where we deploy capital as well as implementation support. And so what I always tell startup companies here, and I say this lovingly from the health system perspective, is if you expect the health system to understand all of your needs, wants, and be able to kind of shepherd you through in an expeditious manner with a mindfulness of like your burn rate, like, we will wear you out. It's
Yeah.
not shocking for a 9-12 month runway to get a product deployed. And if you're a startup company, and I've had this happen a lot of times, they're like, oh, you know what? We don't need financing right now. We've got some seed investment here. We've got 12 to 24 months cash on hand. And I tell them, I was like, you know what? I could eat up half of that, or a health system could eat up half of that without even inking a deal, giving you a verbal commitment. So what does that tell you? And it's not the fault of the health system, but I think, you know, as my colleagues had pointed out here, you know, we're a heavily regulated industry. Think about this for a minute. We're probably one of, if not the only industries whose market is heavily set by the regulators. Like, there are literally things that you cannot do and you have to do regardless of the business case, right? And so when we think about that, we're not entirely in control of how quickly we can act. And so you will burn through that capital very quickly. And you're right, Anthony, it's not anyone's fault. It is just a matter of health systems are also trying to figure out how these things go, right? Decision making in health systems, while the layering may be pretty crystal clear, it only takes one person or one doc or a nurse, for instance, that says, gosh, you know, I've got some concerns about the clinical aspect of it. And I think, as Warren had pointed out earlier, like, that's everything, right? We're not in the business where we can walk away if something goes south. Like, people get hurt, communities get impacted. And so, you know, you burn through that cash very quickly, not for a lack of want or sabotage, but that is the nature of the market that we're in, right? And so you have to be really tight in your execution. Otherwise, 12 months will go by like that, right? I mean, contracting sometimes could take 6 to 9 months alone. And it's not because people are dragging their feet. It is because, you know, boilerplate language in some instances might not exist. Guess what? Someone's got to write that, right?
Uh-huh.
They got to be believing in what you're doing and understand what that looks like.
But now ChatGPT can help you with the boilerplate language, get that done in
There you
about
go.
35 seconds. So let's go around the horn on what we were just talking about. I'll get other thoughts. Warren, any feedback on this idea? I think the you know what's on the table here is um, that the startups need to understand how much they need to bring to the table in order to give this thing the proper chance. So they may say, "Oh, I'm ready to do a pilot." Like, no, you're not. No, you don't have you're not ready to do a pilot because it's going to take a lot more out of you than you think. Warren, anything there?
No, I think, you know, as Kelly says, part of the issue is the conversation and the dialogue. You know, startups are obviously looking to get a foot in the door, and sometimes there isn't a full appreciation of what it is to interact with a health system or even a single hospital. I would say that it is best to be upfront in those conversations about what the needs are on both sides. I think it's also incumbent on the health system to, if you are truly interested in engaging with a startup, to know what that wherewithal is going to take. It takes a
Yeah.
very different posture to engage with a startup than it does with an entrenched incumbent. So if you bring your existing playbook, as you would with an entrenched incumbent or your typical sort of vendor-customer relationship, you're in for a big surprise and probably going to be sorely disappointed, because a startup is likely not going to be able to check those boxes and isn't going to have the level of maturity that some of these other companies do. So I think that initial conversation and the due diligence upfront is critical to ensuring any runway or flight into the health system, whether that involves capital investment or just sweat equity. Those candid dialogues become critical to understanding the roles of both the startup as well as the health system in ensuring a successful partnership.
Excellent. Deanna, anything you want to add in there?
I'd add that integration into our existing ecosystem is a big factor in how long those initial pilots or how successful they are. It's not uncommon to have a group come in and say, we need all of the data and we need it to flow bidirectionally. It's almost a non-starter for a new startup to come in with that degree of expectation. They often don't have the skill set. It's not just simple APIs, as much as it's really hard for anyone from technology outside of healthcare to come in to the regulated and how integration typically works. So it's trying to figure out, Nick said it in a different context earlier, kind of the stepwise aspect of getting something turned on. He was talking about in terms of ROI, I'll talk about in terms of turned on, having scaled expectations of what a pilot can and should be. I think Kelly said it right. Like, we can absorb a lot of time in health systems just through normal processes. So trying to set clear expectations and get something in place is better than I think sometimes what the dream is out of the gate, and knowing enough about the industry and their space and the competitors to understand how to scale that appropriately is really important in getting your foot in the door.
Yeah, so Deanna, you're saying you have to lower your expectations sometimes as a health system, and you can't expect them to have this amazing integration right off the bat, day one.
And they have to lower their expectations. A lot of times it is a startup coming in thinking we want a lot of integration. It should be easy, but it typically isn't that easy to stand up for a multitude of reasons. And so having a way to do it with less lift is often going to be a way to get your foot in the door and then improve as you go, rather than make the kind of activation energy so high up front. And I think that's really important, for at least at a place like Hopkins.
Excellent. Nick, any more thoughts there?
Just add that, I'm thinking back to the implementation projects we did at Pertennis with Maryland, Sharp, and Hopkins. And to the point that Deanna was just making and the stepwise value, all three organizations were dealing with EMR changes as we implemented. And we had to discuss what is the value of implementing on the EMR that's going away versus waiting for the new one to be rolled out versus doing a transition with you during that process. And how can we recognize value? So I think it's understand the process. Now you can unlock that along the way. But I think the other part that I'll add is sometimes it's about finding the right first few customers. And sometimes nothing to the to say anything against Sharp or Maryland or Hopkins, but all three of these organizations may not be an ideal first customer depending on what you're doing. And I think sometimes startups need to really think through who is the best first customer for us. It could be a really big hospital system like Kaiser or HCA, or it could be a really small single standalone hospital. And there's not like a textbook answer here. It's really understanding like where your product fits in and what the needs of the customer and your ideal customer profile. And just to start, and then it's about building from there and unlocking the market. But really understanding the customer profile, I think, is easier said than done.
I think that's a really, really good point. Nick, is there anything you would want to tell other founders or people, startups who are going to start getting out there and trying to work with health systems about sort of the culture that they kind of have over there? For example, I'm thinking if you're too aggressive, maybe that's not going to work. If could you say about the culture of healthcare and dealing with health systems that startup founders, because again, these are type A personalities, right? Really driven, very aggressive. Maybe that doesn't always go over well when things can take 6, 7, 8, 9 months. Maybe that manner of trying to push the ball forward may backfire.
So I think the key word in developing strong relationships early on is partnership. And I know that sounds really obvious, but I'll be very specific. Um, Oftentimes when I talk to an entrepreneur, they say, "Oh, we have this pilot we're talking about with organization X," and I say, "Great, who do you know there?" And they say, "Oh, we're working with Dr. So and so." And I say, "Who else?" And they say, "No, that's our contact. We've got it." And I say, "Okay, no, no, no. For an enterprise partnership, you really need to know all the players, all the stakeholders, who from security, who from IT, who from compliance, who from nursing, who from pharmacy. Like, who are all the right people to be engaged with and partner to make sure that they're all part of that journey together, because nothing happens in healthcare in a vacuum and in a silo, and we have to understand all the inner workings throughout the relationship. The flip side of that, though, I don't want this whole webinar to sound like a cautionary tale of don't innovate in healthcare. It is hard. It is really hard, and there's a lot of barrier to overcome. The reward, though, is if you figure out the puzzle and you figure out how it works and you build that partnership, there's so much opportunity to have impact, because not many companies do get through and have the opportunity to work with health systems. And when you do, there's more room to actually create impact and see your results. And so I just want to really stress that while it's really hard, it's worth it to be able to fight through that, because then you get to see the impact on on the back end.
All right, let's go with some positivity, Nick. I get that. I get that. It does sound scary. It's making me anxious. So let's go to the rest of the panel and say, well, you don't have to name the startup in question, but a successful startup, something that's someone has approached you, a startup, and it's been successful. What were the characteristics of that engagement? And you can go, the gamut, any aspect of it. But when you think back on startups where things have proven successful, were there any commonalities, anything that stood out that attributed to that success? And we'll go on the positivity front. Kelly, let's start with you.
I love the positivity angle here, because we do strategic investments as well as piloting, and we've had a couple of examples where on the strategic investment side here, we believe so strongly in a couple of groups that we've been working with that we did make a capital investment in them. And so some of the characteristics that really stood out was they came to the table prepared. And we're not talking a Series B company, right? This is a growth stage company. They came to the table understanding, hey, health systems are complicated. They're large technology organizations. And so the platform that we had developed and invested in with them, there was an understanding and an appreciation for how this fits into the broader mosaic of a complex healthcare infrastructure. So it wasn't just a, hey, give me your data. It was, hey, I understand moving data in a secure manner is going to be challenging in a cloud posture. How do we firewall that appropriately? How do we make that a pass through and establish a revenue share? So when we're able to do that, it wasn't like pulling teeth, right?
Yeah.
They knew the questions that I was going to ask, and it was a dialogue around how can we work around a negotiation and a partnership that works, as opposed to coming to me with a great idea and then me having to educate that individual around like, hey, here's the 15 different things like we need to think about here. Like, how's this going to increase my cloud spend? How are we going to cover that? What other tools are you going to need? Because we use an independent third-party vendor to manage our cloud infrastructure, and that costs us money, right? So I just being able to understand and coming to the table with, hey, here's all the infrastructure that I need. I can appreciate what this is going to cost and the investment that's going to be on your side to be a partner. And that goes a long ways for me and my team and our IT teams to be able to say, hey, we all get it. There's no free lunch here, right? But these guys know what they're doing, right? And they can come to the table with a deal. And so much so that not only was that a successful venture, but we also did a capital investment in them as well, right? And so per Nick's point here is health systems can be your best friend once you figure out a way and you come prepared. And come prepared doesn't mean you have all the answers. It means you come with an appreciation and an understanding of the mosaic that Warren, Deanna, and I are going to have to deal with once we get off of those Zoom calls and we have that great idea. It's the first thing that many of us, or at least I think about, is, okay, gosh, how am I going to figure out this puzzle, and how is this going to fit into the mosaic of our health system, right? Make that easier for me, and then rewards will come. And when that does come, I mean, to Nick's point here, I mean, Protennis has been a great partner for us, and once they're in, they're in. I mean, I couldn't rip them out even if I wanted to at this point, right? But they're a good partner for us, and that's the same thing with some of these other startups.
Excellent. Warren?
Yeah, I'll just echo, I think what Kelly said very eloquently here. I think trust and credibility are the cornerstones of any great partnership. And I think we don't have to go very far. If you're looking for an example, I think Nick and what he's been able to do over the last decade is really, I think, a remarkable blueprint that a lot of founders and startups can follow. I don't think, at least my own view, is that you don't necessarily have to have all of the answers figured out on day one when approaching a health system, but you at least need to have a good size appreciation of what it's going to take to engage in that introductory as well as initial partnership with the health system. I think it also helps to have a viable economic model because I think others have alluded to this before. Having a great technology, having a great idea in and of itself is not compelling enough, given all of the other externalities and pressures that health systems deal with. But it really comes down to the trust and credibility that either founders or startups can engender with health systems that are going to get health systems to come to the table or want to come to the table to engage. I think the bits and bytes obviously have to be considered. I think Deanna's earlier points about integration, scaling, understanding how that plugs into the architecture of the health systems ecosystem is really, really important. But I think if health systems approach this with a pragmatic view of what is going to be required, and if you have the wherewithal and credibility in order to navigate some of those choppy waters, I think you're more likely to have a very fulfilling and rewarding experience interacting with health systems.
Very good, Deanna.
I think Kelly and Warren also both said it well. I'd add some of our best early collaborations have been with folks with a great idea, a good vision, a good niche to fill in. And they come and they have caught the attention and of a group that has a problem to solve. For us, Artifact was one of them, which is kind of a clinical documentation support. How do we make it easier, better for our physicians who couldn't answer queries from soccer fields, et cetera? How do you get that degree of attention? Once you've gotten that vision, how do you also collaborate with the technical folks to say, could we make this work? And I think going back to what Nick says, there's a couple different players in a health system, and it's capturing and it's listening to all of them or a couple of them, and then using those to help you navigate through. Those have been our most successful. So clear vision for the group whose problem they're trying to solve, and then good teamwork with the technical team to figure out how we can do this effectively has been a really good formula to then be a good starting point, at least for earlier stage companies. Big credit to a number of them have started well. Also going back to groups like Techstars and other that can help mentor these companies to help navigate that complexity, because it's both sides of the coin.
All right, very good. We have a question from the audience, and it's similar to the one on the screen. This is, what people always want to know is, and Deanna, you mentioned partnerships, right? Techstars like have a connection because the cold email probably not so good. All right, let's go around the horn. Let's get your thoughts. How do you get the attention of And you don't always have to start with the, CIO maybe isn't always your target, or maybe shouldn't ever be your target. I don't know. It depends on your product and whatever. Although not every CIO loves to have their users sold to, and come running in with a new idea. They're all excited, and usually the vendor says that this doesn't take any integration and this is really easy. You don't even need to tell IT. We've heard funny things like that. But let's go around the horn. How to get in? How to get attention? Kelly, let's start with you.
Sure. So this is an area, because we're a relatively small team, we have to do this by committee. And so we work closely with the Venture Studio, which has got a national footprint, our local Techstars, a local incubator, as well as we maintain a clinical advisory panel. So there are multiple different groups that I go to. I cannot, and my team cannot be the only team that takes these things inbound. Now, we get a vast majority of them, but I think it would be presumptuous of me to think that, gosh, like only our team can do the vetting, right? We are oftentimes, or I am oftentimes, I miss things, right? So as much as I can get the input from other subject matter experts and other groups, internal and external to Sharp, is critical. And I trust their voices. We have strategic partnerships with Evo, with Techstars, with our clinical advisory panel for a reason, right? I want to hear what they have to say. And so when it comes to vetting the overwhelming flood of ideas, that helps me then have an additional kind of gating mechanism to be able to determine what is worth that next meeting, that second or third meeting. I will say on a personal level as well is that it helps me out as leader of our ventures program. Is I can't always be the no guy, right? Like that takes a toll. Like that is exhausting. And so it helps me on a personal level and from a business perspective to say, hey, you know what, there are objective opinions that are help weighing in on things that maybe I'm wrong on, or maybe help validate what I'm thinking here. So we have a number of different groups that we leverage.
Excellent. Deanna?
$1 million question. I don't know that there is a singular right way to do outreach to our groups. We are a networked industry, so we often talk to our colleagues and friends about what they're doing. And I think that is often a really obscure way in, but it is a way in because there's a lot of noise out there. So a lot of us keep up through industry events. So podcasts, you're looking at industry events like Five and HIMSS and Becker's is trying to any kind of footprint, but there's so much volume there, it's hard to get through. So the reality is it's coming in through end users and understanding as much as trying to understand, can you find groups that work? And then once you're in with your first customer is your best way in across your customers.
Yeah.
That is there. We will always pick up the phone for each other much faster than we're going to pick up the phone for a cold email. And so I think that early stage partnership is so critical. And then working with them to make the introductions and figure out a little bit of a way in. That's what's worked well for us. And we really appreciate it when other groups are letting us know where they're going.
Perfect. Warren?
Yeah, Anthony, I would say if somebody's figured out the answer to this question, I'd certainly like to know, because I'm not sure that I certainly haven't figured it out. But what I would say is I think what Kelly alluded to, this has to be a team sport. I don't think this can be put on the shoulders of just CIOs or innovation officers in health systems to unilaterally sort of decide on what gets through the gate and what doesn't. I do think there needs to be a collaborative effort. If it's in the clinical space, the engagement, I think, of the chief medical officer or the chief clinical officer is critical for anything to move forward. And I'd say from a startup lens, if you don't have the appropriate stakeholders engaged, and I think Nick made this point earlier in the conversation, if you don't have the right folks from the health system engaged in this type of endeavor, it's unlikely that you are going to get very far. And so it's just a cautionary note for both sides, both the health system players as well as folks in the startup ecosystem, to ensure that this becomes more of a collaborative effort as opposed to a sort of single point of failure where you're trying to send out these cold emails or phone calls. Unlikely that that singular point of traction is going to get you very far. I do agree that I think more of a consortium or network type approach makes a lot of sense. And I think some startups are doing this really well. So rather than approach just one health system, they tend to create a network effect, whether that's by orchestrating, webinar type ecosystems just to build awareness of technologies, products, solutions. Is a way by which you can enhance the credibility. But the cold call approach does become very overwhelming. Our inboxes are always flooded, and it's unlikely that those types of engagements typically result in a callback or someone wanting to take a meeting. But again, if someone's figured out, and cracked the nut on this, I would certainly be willing to listen because it's certainly a problem that I encounter personally. And I know many of my colleagues feel the same way in being inundated with either a new technology or another potentially Me Too solution that's trying to find an entry point into the health system.
Very good, Nick.
So I think the best answer I could give here is it's about working smart and working hard. There's no easy button to get access to the right people. So on one hand, I do think a brute force approach of cold emailing, cold calling, cold connecting, cold LinkedIn messaging, that does work. And you may be talking about a 1% yield, but I think it also is really informative. I can't say how many times another AI scribe company or another, fill in the blank company reaches out and says, I've emailed everyone, no one responds. It's like, well, I think that's your answer. I think that market is saturated. I think there's, you're not getting people's attention because you're not differentiated in any way. Your message is not compelling to get people's attention. So even the lack of response, I think, is helpful and important feedback. But the other side is the work smart and what everyone is talking about with the partnerships and how important human relationships is, not in just healthcare, but in any industry. And when you get an introduction to someone, I never take that lightly. That's so valuable because you're stepping on the backs of the credibility of others. And when they're willing to do that for you and get the connection, you better not waste it. And you better make sure that you bring your best forward, because that one connection can turn into 5 connections, can turn into 500 connections. And so it's really about being in your best and taking advantage of those great insights when someone's willing to help you out. But it's not just all easy. I do think it's a lot of blasting as well.
Yeah, very good, Nick. We're almost out of time, but I do want to ask you, what do you want folks to know? And you take it for 2 constituencies: the CIOs and the innovators at health systems, and then the startup folks. What do you want both those constituencies to know about Techstars?
So my pitch as managing director of Techstars is that, one, I'm looking to recruit really great companies that we can help and support. And so the people on this call, the people that we advertise this webinar to, the people in the industry, they're all working with really great companies that are just starting or just been identified. And what I want to do is bring those companies in and build on that success. And my offer back is that I like to consider myself as a little bit of a filter, that I want to look for really good companies and that are close to being really successful, and help them get across that finish line, so that then they are working, they do get that connection to health system. It actually is solving a real problem. It actually does have an ROI. It does have an impact. It is aligned with strategic initiatives. And so my ask is to just love to connect with people and continue to connect people with the ecosystem and find ways to be valuable for the companies that you're working on, but also help make sure that you're not just getting blasted with companies that's like, oh my gosh, look at every 10 companies that go through our accelerator and you got to talk to each one, they're all great. That's not helpful to anyone. It's about finding the right companies for the right systems that are really solving problems that are forefront of mind.
All right, let's go for 30-second lightning round responses. Best piece of advice, and I want to frame this up for the innovation leaders and the CIOs at the health systems who are trying to be innovative and trying to pick the right companies to work with and trying to get those things moving and trying to get them to scale and all these kind of things. What's your best piece of advice? We'll go around the horn. Warren, let's start with you.
Yeah, I would say, if very simply, three things. One is know the problem that you're solving for. Never lose sight of it. Ensure that you are staying close to what it is the pain points are and what the actual constituency within the health ecosystem needs. Second thing, when engaging with startups and some of these disruptive technologies, make sure that you have the right outcomes identified. If you start a pilot, engage in a pilot, and then you're trying to figure out what the appropriate outcomes should be or how they should be measured, that's a little too late in the game to do that.
Yeah.
And then the last thing I would offer is not to underestimate the need for change management. Healthcare is sometimes entrenched in the way we do things, and sometimes breaking that mold does take some change management, both collaboratively from the health system standpoint and the startup. And so keeping an eye on change management is critical to ensuring success.
Excellent. Thank you, Warren. Kelly?
I'll leave with a bit of optimism here, and that is a no is never always a no. If a no is a no based on an early stage startup that's trying to sell me their subscription, and say, no. But if that no turns into, well, what if we're looking for a design partner, a co-development partner, right? Because the earlier stage company, the more you can ask of me and the more investment that I make in you, whether it's sweat equity or capital. Because health systems need change. We need innovation. We are not going to figure this out with the traditional EHR vendors. And so whether we admit it or not, we need new entrants. And I think when you introduce yourself to health systems, offer something else up. Don't propose to have all the answers, but instead say, hey, help us develop this then. And guess what? In exchange for that, there'll be some kind of negotiation. So a no is never always a no. It might just be a no based on your first offer. There's always room for different kinds of relationships.
Excellent. Deanna?
Be a little bit different than Warren and Kelly, who I think gave great advice. I would say make sure you're focused as you're coming in and you're pitching. You're not going to solve all of healthcare's industry with your startup, not right away, not in your first 6 months. So be focused and don't forget to have a little bit of fun. Innovation is often kind of the extra. It's the fun part of our job. The idea of doing something innovative and different and not just the day-to-day is something people are willing to put more time and energy into, but it's a personality game. It's often making that work enjoyable, which it often is, but you have to bring that back to the customer, not just within your own startup. So something to consider when you're coming into health systems too.
Very good advice. Don't be miserable to be around, right? Be a little upbeat and fun. You're supposed to be innovating. I love it. Nick, we'll give you the last word.
So I know from the registration list that we have both hospital executives and startup CEOs attend this webinar. So I'm going to say one thing to both directions. To the health system executives and innovation leaders across healthcare, I would say one of the most valuable things you can do for a startup is to tell them no and tell them why. And I think oftentimes it's hard to deliver bad news. You want to be able to say yes, or if you can't say yes, you can't say yes, you just don't want to say anything at all. But honestly, sometimes like this is what I coach founders to do is you need to know why they said no, and you need to figure out how does that feed back into your product. Is there no market here, or are they not the right customer for you? And so sometimes saying no, we can't do this because we have a competitor, because we have vendor lock-in, because we don't have budget, because we don't see the value proposition. All that is data that can go back into their engine for them to iterate. So be mean, tell them exactly why you don't like the product, and the only thing they can do from that is learn. So the founders, my best piece of advice that I was received was that starting a company is like running through the woods naked backwards. You are going to be wrong on everything. You're going to make an idiot of yourself. You're going to mess up. You're going to trip. You're going to fall, and it's humiliating. And so just be ready for that you have to really think about the mentors and advisors and support system you set up around yourself to be able to solve that puzzle, because you can't do it alone and you can't just figure it out in your first try, and you got to iterate and get that support network to help you get onto the other side.
Wow, that was an amazing conversation. There's many nuggets in there that I think are super practical and can help people move forward. So I want to thank everyone for that discussion. Regarding continuing education, you could use the final slide in this deck. You'll get an email when the on-demand recording is ready for viewing. If you want to work with us, you can reach out to Nancy Wilcox from our team, and you can go to our website to register for upcoming panels. So with that, I want to thank our panel, Warren D'Souza, Deanna Hanisch, Kelly Coe, and Nick Culbertson. And I want to thank Techstars for sponsoring and you for attending. And with that, everybody have a wonderful day. Thank you.
Sorry.
Thank you.